just when you think the corporations can't get any lower, well, you find out they can get lower. I think they could get as low as hell. Let's face it. Yeah, so I learned last night that one of the things the hospital outsources to is they outsource to some company that will call the intake department, and they'll pretend to be a patient that's suicidal or needing help, and they'll give their insurance, and they go through all this, questioning, and then what it is it's just a setup, because then the intake workers will find out that maybe a couple weeks, a month later, that they've lost points towards their raise because, well, they didn't handle the criteria quite right. This happens twice a month. It happened last night when I was in the intake office, and I'm like, you're kidding, right? You are joking. You mean to tell me this huge health system that has all these awards, they have all these awards as being one of the best healthcare systems? No. When they're a healthcare system where people have had their teeth knocked out and other things, people beat up, then no. That tells you what all those awards mean. But I'm like, you're joking, right? You mean to tell me they pay a company to do this? She's like, yeah, we caught on to it. She's like, they tell us anyway because we end up losing points if we didn't manage the call the way that we're supposed to. But she said it can take like 20 minutes. She once had to take one of these phone calls while leaving a patient, a real patient, just to take this phone call. It's unbelievable. And then they caught on to it too because they said they would look up the name that the person would give, and it was always somebody that's deceased. That's what corporations are doing. To set their employees up, to spy on them, to be creepers. Oh, it's just, they're such reprobates. And they think, the CEOs in this country, they think that they're the new leadership for our government. Yeah, but and the healthcare systems thought it a long time ago. They don't think that we little people are responsible enough to manage, running the country. So, this was regarding Universal Health Services. We entered into an agreement in April 2012 with the United States Department of Health and Human Services, the Secretary of Health and Human Services, and the Centers for Medicare and Medicaid, referred to collectively as HHS. That is expected to result in an aggregate cash payment to us of approximately $35 million, the majority of which we expect to receive on or about June 30th, 2012. After reductions for estimated related expenses and the portion attributable to third-party non-controlling ownership interests, we expect this settlement to favorably impact our pre-tax consolidated financial results during the 3-month period ended March 31st, 2012 by approximately $30 million. This agreement was part of an industry-wide settlement with HHS related to litigation that was pending for several years, contending that acute care hospitals in the U.S. were underpaid from the Medicare inpatient prospective payment system during a number of prior years. This underpayments resulted from calculations related to rule floor budget neutrality adjustments that were implemented in connection with the Balanced Budget Act of 1997. Yeah, it goes on and on. So this is just so convenient for them, really, because the federal government just doesn't send them the money and pay them, and then that's how the federal government, and that's how the public-private partnership works. So then that's how you get an employer that doesn't care what they do to you. They don't care if you get hurt. They know that they're in with the government will protect them, and the CEOs seem to think they're going to be running the country. I guess they have been, but I think that will change, God willing. Yeah, and there's this whole Purple Strategy. Yeah, They've been at this for such a long time. These people think that they're so important. They don't realize that they're the scummiest of all. They just are. Just some of the things they say. So they have all these purple strategies. This would be the CEO forum group. Yeah. And they have all these different meetings because, you know, that's all they do is have meetings and talk about how glorified they are and how much they're going to do for healthcare. Well, no, they're not going to. No. So, one of their articles says CEOs embrace risk to reveal courage in the face of change. Sure they do. Let them come and work at one of their hospitals where they don't staff enough and have a patient try to beat them up, and let's see how brave and courageous they are. Yeah, I think they're just scumbags. Sorry, just do. I think they're proving that perfectly. They're proving that. Also, they're about the ESG. Yes, meeting ESG goals is the key to future business success. No, I don't think so. During the summit, CEOs discussed how meeting ESG goals often demands a longer timeline than financial returns, but can lead to more important rewards in the future. An inclusive, diverse workforce, clean water, and healthier... Oh, I'm just not even going to bother. It's all nonsense because these people are nonsense. And the AI and paradigm shifts of the minds of healthcare CEOs... And that this is one of their quotes, but all of them are hilarious. So, it's about a new definition of collaboration. It is partnerships, healthcare, and high tech. It is partnerships between networks and systems, both U.S. and internationally. It is taking off the pride and the ego and saying, I'm here to learn, and how can we learn from each other? Oh, you hospital CEOs, you have the biggest egos on this planet. So for any CEO, and this was healthcare industry CEOs, it was just a bunch of CEOs, for you to make this statement shows that you have no insight. You think people are going to buy your bullshit. No. So here, part of the problem here is that, and this is why unions end up coming into play, but we wouldn't need unions if the corporations were no longer seen in court as an entity like you and I. It's that simple. Think about it. The place I'm working at, but other places are like this too, okay? Your employers have the right to violate so many of your constitutional amendments where your government isn't supposed to do it, but they can do it. They can record you, they can set you up, they can videotape, have cameras on you everywhere. Then they can outsource companies to call and pretend like they're being a patient, which is just shady, which is just intimidating. That's what the CEOs are. They're nothing more than what I've always said they are, especially in healthcare. Scumbags and maybe a nice suit. That's it. There's nothing to them. They don't give a shit about what they're doing to their staff. They don't give a shit about patients. And there needs to be retribution. Now, of course, I mean legally. But first of all, the number one thing that needs to change is corporations should no longer be seen in court as entities like you and I. Because that's how they've gotten away with violating everybody's constitutional rights, all of their employees' constitutional rights, is because the courts view them as a human being like you and I. Well, no, as soon as that changes, you won't even need unions, because they'll just be in a whole bunch of trouble. Yeah, but I'll get a little bit more into this whole purple strategies yet. It's quite hilarious, everything they have to say, because nothing they say means anything, because they're just scumbags. And they prove that because they allow their patients to not get therapeutic value in their hospitals, and they allow their employees to get hurt while they collect awards and talk about everybody else needing to let their ego go. Yeah, okay, right here.